November 3rd of last year, the Premier released a color-coded reopening plan that was immediately rejected by scientists and public health experts. On February 11th, the Premier was advised that if he reopened too early, we would have a disaster. Well, the Premier reopened too early and we had a catastrophic third wave. On April 16th, the Premier brought in karting in closed playgrounds. Scientists immediately said this is not what we are recommending. So, Speaker, will the Premier commit today to a reopening plan supported by the Science Advisory Table with clear and transparent key indicators for when it is safe to reopen schools, communities and businesses for outdoor and indoor service?
Minister of Health.
Speaker, well, first let me be clear. It's the arrival of the more transmissible variants that actually led to the third wave that we're dealing with the higher rates, and that is why we've been calling on the federal government to do something about that, because that is how the variants came in. However, since we have implemented the stay-at-home order, we're also looking at how we may safely exit it when the time is right, because you're absolutely right. We need to do this slowly and carefully, and there needs to be a plan which is being developed, which is based on the scientific advice and medical advice that we've received from the Chief Medical Officer of Health, the Public Health Table, as well as other medical experts. And it is based on looking at outdoors activities first, indoors activity later, but there will be more information that will be coming forward with respect to this imminently.
Hear, hear. Supplementary.
Speaker, with all due respect to the minister, and I have the utmost respect for this minister, the government has not followed the advice of the Science Advisory Table time and time again. Speaker, this is a matter of public confidence and trust. The only way we are going to combat COVID and get this pandemic behind us is
Minister of the Environment, come to order.
If the public is on side. So I am pleading with the government today, Speaker. Follow the advice of the Science Advisory Table. Have clear indicators. Be transparent with the people of Ontario what the Science Advisory Table is telling them, and give businesses time to plan. No more flip-flopping. Will the government commit to doing that today, Speaker?
Minister of Health.
Thank you. Well, I appreciate the question from the member, and I can certainly advise the member opposite that we are relying on the medical advice that we're receiving from the Science Advisory Table. That's one group, the Public Health Measures Table, the Chief Medical Officer advice, and other medical experts. They are certainly providing us with guidance on when and how things can be opened when the time is right, because there are many factors, of course, that need to be considered. The rates of vaccination, which are going very well, with over 7.5 million vaccines already administered, but it's also dealing with the numbers of new hospitalizations, the numbers of people who are in intensive care units, the R rate, the public health system capacity. There are a variety of factors that must be considered, but I can certainly assure the member, through you, Mr. Speaker, that we are listening to the medical experts. We are following their clinical advice and recommendations, that there will be a plan which will be released imminently.
The next question, the member for Peterborough-Kawartha.